Hi everyone. Today we're gonna do a short hip capsule focus session. We're gonna skip pails and rails. This is all gonna be movement based stuff. So we're gonna do some eccentric work. We're gonna do some kinetic stretching and basically just lots of internal and external hip rotation. We're gonna be doing this in the 90-90 position. So it's definitely worth noting that, the 90-90 position is different for all of us. So some people have the ability to sit really, really upright. That's totally cool if all of your joints are ready to handle that. In my experience though, often being more regressed, just leaning more over to the side is a really good way to manage the intensity here. So just think about like the way that we build intensity on a back squat is by adding weight over time. What I would expect for your 90-90 position is that over time you get the ability to get a little bit more and more upright. You can work harder in those positions. You can get your sits bones lower to the floor. But all that is a much more advanced setup than leaning over to the side. So a lot of this is just going to be going by feel. We shouldn't have any knee discomfort when we're doing this. If you get any low back discomfort or just feels like your hips are really getting jammed up, that's almost always a sign that you're too upright. So we just want to adjust accordingly as we're doing this. So go ahead and get in your 90-90 position. Remember, ideally where we adjust first is by leaning over, but we still try to maintain those 90-degree angles. But if we still can't find enough comfort being in that the 90-degree angles at the knees and the hips, then we can just back this knee up a little bit, pull that front leg in, something that's usually called a shin box or something like that. But that's also another way to manage some of these other joints like the knees and stuff. So find that comfortable 90-90 position. And we're going to start just by doing some eccentric work on the back hip. So, since we're trying to deal with the femur rotating in the hip, that means that our pelvis shouldn't move just yet. All I want you to do here is find a position where you can comfortably get your back ankle to lift off the ground. And that's really just to find where your end of your active internal rotation is. If it's not going to lift there, lean forward, twist this side of the pelvis more towards the front knee. Find where you can get that thing to lift without needing to get the pelvis further forward, without your spine needing to move, right? You should feel no movement there and just get it to lift. And the reason I want you to do that is that's just telling you where your active range stops. And so that means that when we take it eccentrically into that end range, we just don't want to go a huge amount past that, okay? Because it's easy to basically overload that tissue. So here, even though I can get my butt close to the ground, I can't get my ankle to lift at all. And if I really sit down as low as I can basically use all of my flexibility to get down here, I can't even feel the muscles working to lift my ankle. So that would just tell me that I went a little bit too far if I feel like I have no control over my hip in that position. So here's how we're going to do this. You're going to start by twisting this side of your pelvis all the way towards your front knee. We're going to take a breath and hold in some tension, and we're going to start pushing our back ankle down here. Now pushing that back ankle down, you're going to slowly rotate the pelvis back. And we're just trying to generate force, pushing this ankle down into the floor and rotating back until I feel like any further than that I wouldn't be able to push this ankle down very hard. My knee still feels okay. And now slowly relax. Let's do that 3 more times. Now if you start to get discomfort in your knee, that just tells you that you just need to stop the pelvic movement back before you get to that point. So again, start pushing that back ankle down. Slowly rotate, trying to generate that force, pushing the ankle down the whole time. Hold for a couple seconds, relax. 2 more like that, push down, slowly rotate back, hold, relax. 1 more time. Push that back ankle down, slowly rotate back. Okay, so those are eccentrics for internal rotation. Now we're going to work some eccentrics for external rotation. There's a few ways to do this. The way we're going to do it today, though, is I'm going to have you straighten out this back leg and then lean over onto your elbow. And we want to see if we have active external rotation there. I can lift my ankle there. If you were super duper limited and you had to lay all the way to your shoulder to get your ankle to lift, that's also okay. It just means that you're going to probably stop this before you get too upright. So in this case, since I can lift my ankle up here, what I'm going to start doing here is pushing my ankle down. So I'm pushing my ankle into the floor, making sure my thigh is not leaving the floor. What I'm going to do is keep pushing as I slowly sit more and more upright, using my arm to push my torso back upright. I'm still pushing my ankle down. Now I'm going to relax and go back down to my elbow You may have to slide the straight leg out a little bit. That's okay. You can use help from the other arm. So again, nice big breath and tension. Push that ankle down. Keep pushing it down as you slowly bring your body more upright. Take it all the way to the point where you feel like that's about the limit of where you can push that ankle down. And relax. And let's do that again. Nice big breath. Push the ankle down. Keep pushing, 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 pushing. Slowly working your body upright. Slow relax. Let's do it again. Big push. Keep pushing. You know, ideally what you're feeling as you're pushing that ankle down is it's kind of limiting your ability to get back up. It's okay to have to work kind of hard with that arm to get back up. Okay, now that we've done 4 of those, we're going to go back to the 90-90, and now we're going to do a bear sit transition over to the other side. And remember, that's taking a nice breath and tension, holding it in the hold tension through the body. You lift that back ankle up, basically as high as you can get it off the floor. Once that stops moving, let this front knee start to trail through. You know, again, we're just trying to create as much space between our knees as possible. So as I'm driving this knee down towards the floor, I'm trying to keep this one back and away, slowly coming down, letting that knee drop. Okay, so let's check our active internal rotation again. I have some there, so that's just telling me as I come back up, I'm going to take it to about that point. I still feel this stuff working if I try to lift the ankle, but it's not going to lift. So rotate that hip towards the front knee. Push the back ankle down. Keep pushing as you slowly rotate back. Be nice to the inside of that knee. Relax, repeat. Back ankle down, pushing as we rotate that pelvis back like we're trying to get our sits bones lower to the floor. Take a big breath. Rotate forward, push down, keep rotating back. You can hold for just a couple seconds and relax. And one more time. Push down, keep rotating, and relax. Okay. Oh, excuse me, allergies are kicking, man. Okay, let's find our active external rotation on that front hip. So straighten out the back leg, start on your elbow, see if you have active external rotation there. If you need to, go all the way down to the shoulder. Now start pushing that front ankle down. I'm creating pressure right under my ankle and my thigh stays down. I'm pushing. I'm continuing to push as I use my arm to get my torso upright, still pushing the ankle down. That's the limit of where I can go and still work pushing the ankle down. So I'm going to go back to the elbow, big breath and tension, push that ankle down, keep pushing it, push, push, push as you slowly work your way upright. Relax. You know, if you found that you had too big of a stretch on the inside of this leg, you can bend that knee, just find a comfortable position for your back leg. All right, let's repeat that. I think we have 2 left. Ankle down on the front. I'm pushing it down as I use my arm to push myself back upright. Pushing, pushing, pushing. Relax. One more time. Again, start pushing down. Okay. I'm going to go back into that 90-90 position. We're going to bear sit back over to the other side. So pull that back knee up. Some nice space between the knees. Keep just slowly transitioning as you continue to pull those knees apart. Trying to keep the back flat. You can totally lean back on your hands here. That'll help keep the spine flat. If you have lots of hip mobility, maybe you're doing that hands-free. Now we're going to do 3 kinetic stretches on this front leg. We're going to go to the other side and do that again. So kinetic stretch here is basically trying to use all of the tissue that would pull us forward and lift the ankle. So stuff that's going to give us more external rotation. So I'm going to start by lifting my ankle up. It may barely lift off the floor, but I'm trying to do this in a position where it doesn't really lift. I just feel all of that stuff in my hip working to lift it. So I'm going to take a nice big breath. Try to pull the ankle up. Keep actively trying to pull the ankle up while you flex the hip. So I'm pulling myself down. I'm thinking about lifting my belly button up and over my shin. I'm trying to flex my hip and externally rotate. That's as low as I can get without letting my back round, right? We want that pelvis to tilt forward. That's where I'm going to stop. Now I'm going to drive my whole shin into the floor, and I'm slowly going to push myself back upright. Again, big breath. Start by trying to externally rotate. Try to lift that ankle. Keep pulling yourself down. Think about pushing that tailbone back behind you so we keep that low back super flat. Still trying to lift the ankle. Now I'm going to push my whole shin down on the floor, like I'm trying to push the floor away from me. That's pushing me back upright. Again, one more time. Big breath, big tension. Try to lift that ankle. Keep trying to lift it up. Now drive it down. Push yourself back upright. Okay. Bear sit transition over to the other side. Show you a hands-free one here. So again, if you have enough hip mobility to keep the back flat while you do this, for me, in the beginning, I could get a way more intense feeling in my hips if I used my hands on the floor, so I recommend that. You just end up loading up your back a lot more if you don't have the hip mobility to take your hands away, so staying back on the hands is good. All right, external rotation, kinetic stretch here. So again, starting nice and tall, big breath, start to lift that ankle, squeezing tension through the whole body as I pull myself down. Again, trying to get that belly button up and over my shin. That's just in my mind, but that's helping me keep my back flat. Drive that shin on the floor, push your torso back upright. Breathe, inhale, hold tension. Keep trying to lift the ankle as you come down, pulling yourself down into that big stretch. Push the shin into the floor, slowly push your body back upright. One more time, lift that ankle. Trying to pull yourselves forward. Now push. Keep pushing. Nice. Okay. We're going to bear sit over to the other side, except we're going to stop in the middle and try to do some basically pelvic movement, which in this case is going to have our femurs be stable in one position. We're going to try to get that pelvis to move over the head of the femur. So we're going to bear sit up. And we stop in the middle here. So I'm just going to actively try to pull my knees apart. I'm going to actually show you from the side so it's a little easier to see what I'm doing. All right, I'm going to try to do posterior-anterior pelvic tilts here. I don't have a ton of mobility here. You can see I can maybe tuck my tailbone a little bit and tilt it back. But what's really helpful is just to move your hands back a little bit. And let's do 5 of these nice and slow. So I can get more pelvic movement if I lean back. So I'm going to tuck my tailbone. That's as much as I can tuck it, like I'm just trying to round my low back. And now I'm going to try to tilt my tailbone back, but I'm actively pulling my knees apart. So again, tuck. And tilt the tailbone back. It's an anterior tilt, pulling the knees apart. Again, tuck the tailbone, posterior tilt. Tilt the tailbone back, anterior. Keep driving those knees apart. We got 2 more like that. Tuck. And tilt back. And one more time. Tuck. And tilt. Okay, take that bear sit all the way back over to the other side. I'm just going to readjust here so you can see a better angle. Okay, we're going to do some kinetic stretching for our back hip now, which is the internally rotated one. So what we're going to do here is twist forward again, like the way that we started those eccentrics. Now I'm going to lift my ankle up. Now I'm going to keep lifting my ankle up as I rotate my pelvis back. So fight to drive the knee down, keep lifting that ankle up, twist the pelvis back. Oh, that's as far back as I can get while I still feel like I can lift it. So now I'm going to drive this ankle down and use that movement or that muscle contraction essentially to push my pelvis forward towards the front knee. When you get all the way forward, lift that ankle up. Keep lifting it as you rotate back. Keep twisting back. Make sure that you feel the pelvis moving here. Keep trying to pull the ankle up. That's as far as I can get. So I'm going to push the ankle down and push my pelvis all the way forward towards my front knee. We're going to do that one more time. Again, hover the ankle. Keep hovering. Keep rotating the pelvis back. Keep twisting back as far as you can go while trying to lift the ankle. And drive that pelvis forward towards the front knee by pushing that back ankle down. All right. Give me a bear sit back over to the other side so we can repeat that. It's nice and easy. You know, ideally when you get to the other side, you're still in your 90-90 position, but if you're not, feel free to adjust your feet, get back to those 90-degree angles if that's where you were working on the other side. Again, we rotate this side of the pelvis towards the front knee. We lift that ankle up. Keep lifting as we twist the pelvis back. Try to rotate the pelvis back just until you can't lift the ankle anymore. You should feel a really intense contraction right in the side of that glute. Drive that ankle down, twist the pelvis forward. Again, lift. Keep lifting as you rotate back. Drive that ankle down. Push yourselves forward. One last time. Twist, twist as you lift. Drive that ankle down. Twist that pelvis all the way back towards the front knee. All right, I'm sweaty now. Hope that was challenging for you, but reasonable. We're just gonna finish with that really important thing that our hips do, which is hip capsule cars. So we just wanna round out all of this movement expansion stuff that we did by just training that in a really easy position. So go ahead and lay on your back, hand on the pelvis, hand on the knee. Remember, this is strict rotation. We don't want to allow any linear movement. So my kneecap should be spinning under my hand. So I'm going to internally rotate. That's all the way to my end range of internal rotation. I'm going to go back to external rotation. We're going to do 4 more like that. Again, don't let the pelvis move. Brace hard through the abs. Internal, external rotation. Again, internal, external. 2 left. Keep trying to squeeze in that end range of each position where you feel like it stops moving. We're trying to work here. Okay, switch sides. Internally rotate, external. Here's 2. Squeeze in each position. Make this work. That was 3 and 4. Let's get that last one. 5. All right, there's your hip capsule work. Have a good day.